Healthcare today, is it what we want? Stay tuned. Great conversation coming up with Dr. Barrett and I. Join us. This is Libertarian Viewpoint, and I'm your host, Sue Jeffers. Libertarianism is all about liberty. Liberty is the exercise of freedom that doesn't impinge on the rights of others. We have all heard the constant drumroll of government solutions. The purpose of this show is to allow you to see for yourself why non-government solutions are a better alternative. Today's guest is Dr. Dan Barrett. Welcome.
Hey, thanks for having me.
Very happy to have you here today.
Thanks for having me on.
You're a doctor, and we're going to cover a broad range of issues today. But let's start with healthcare in general. And there's a lot of government involvement in healthcare. As a doctor, do you want to give us your perspective of government involvement in healthcare?
I think that was it. There's a lot of government involvement, either by design or by default, just left over from decades of policies. You know, as you know, our challenge in healthcare is paying for it all. So it seems to me when the government is now trying to solve it, you know, what happens in my office, and we were talking about this earlier, the government says, okay, you know what'll help? Let's get electronic records. Electronic record keeping, that'll save us some money. Except in my office, that electronic system added $30,000 in software and about a dozen copies of Microsoft Windows and computers in every room, IT people to wire the whole building, IT people to show up whenever something doesn't work right. And instead of, years ago when I first got in practice, you'd go down to, I run a private practice, so you'd just go to Office Max and we'd buy a ream of paper. Well, now we have boxes of reams of paper delivered because still, even though it's electronic, you have to print stuff and mail it. We're basically doing two things now. So,
it's really interesting in the state of Minnesota. We were one of the first states, Tim Pawlenty signed it into law, that Minnesota requires doctors to have electronic medical records. Here in Minnesota, we store ours in Maine. In the state of Maine. We don't even keep them here in Minnesota. You talked about the $30,000. You talked about the extra staffing. How is this saving any money?
Maybe it's saving somebody else money. Maybe it's part of putting people to work. Maybe it's part of a stimulus package. I don't know. Maybe that's what's going on. But all I know is I employ more people. I pay more people to do what used to get done 10 years ago. There's just more expense to do it.
Now, one of the major hospitals just had a computer with patient records stolen.
Disappeared, right.
Stolen out of his car. Is that a serious concern? Obviously not for your practice.
No, I've had that happen in my office too.
Oh my gosh.
Our office was broken into, and this was like 5-6 years ago, and who would have thought they would have taken a copy of the backup? Now, you need the software to read it, of course, but the backup disk left the office with the safe.
I'm guessing that it happens a lot more than anybody realizes.
I'm just one office out of hundreds of thousands. So
Right.
if it happened to me and it happens at a hospital here, well, you can do the math. It's happening pretty regularly, and fortunately, you don't hear about the terrible things that are happening. But you're absolutely right. That's.
How about data entry errors? Have you run across much of that?
That's probably not any more or less as a result of, the government requirements. That's probably been about the same. I would say this, though, that we have had a great challenge in staff expense because of all the links in the chain, getting from my office to my software to what's called a clearinghouse, then back to the insurance company, and then back again. So between the patient and somebody actually paying for their care, there's all of these pieces. So we ran into great difficulty a couple of years ago with clearinghouses, software. I don't, I'm not a tech person, but as I understand it, what happens is if you know anything about how a printer works, you make a thing in Microsoft Word or something like that, and then it changes to a different language that your printer understands. Well, now, so what they did then was they just said, okay, it's already kind of in that format. Let's capture that information, and we'll just put it in all the boxes for the insurance company on a thing called a HCFA form, which used to be typed up on an IBM Selectric, you know, and then you'd put it in the mail, and that's how it used to work. And then we had the crazy, you know, pin dot wheel things, and the thing would pile out on the floor, and you'd have all these forms, and you'd mail these forms. So I would say this: it does save postage. That expense has gone down. But overall, everything else has gone up, and including big, long jams. I know whenever Medicare changes one little thing, Medicare changes, and it stops up everybody from the top to the bottom, from our office to the clearinghouse, and then even the payers, because there's different payers in different states. So everybody's got to get on board every time somebody makes a little change. It's just amazing. It's just amazing.
Is there one software program that everybody
No.
has to use, or
No,
you can?
There's no standard. Right.
I can just see this tangled web and where
Right.
it's going to end up. It's
Right. There is no standard at this point.
Oh
So,
my gosh,
and that's true in the billing system. That's true in radiology. There, you know, every hospital's got their own system of radiology. You get, you know, everybody's got their own software. You got to have all these softwares on your computer. So it's an incredible demand technologically on you know, a small office like mine, which is, you know, most of really healthcare that gets done.
We talked about, right when we started the show, we talked about how insurance became tied in with employment way back about the Depression. And then we started to see more and more government involvement. And when I was asking you before we started the show what you thought of Obamacare, you said it might be a really good idea.
Yeah, not because I think everybody gets everything paid for, because I think the system is so screwed up. I think Obamacare will push it over the edge faster. That's my personal opinion. It is so screwed up. I mean, you know, imagine, Sue, if your grandparents had a card that they got from their employer, your grandfather got from his employer, and he could give to grandma, and she could go shopping, and she could buy food at the festival or Cub Foods or whatever existed back then. And that's what your parents learned, and that's what you learned. You have this card. You just go to the Cub Foods and you get food. Well,
Free.
Right. Well, darn it, if you don't deserve lobster every day. You got no idea macaroni and cheese is 69 cents and lobster is $20 a pound. You got no idea. And that's kind of what we see. You know, if you were unfortunate enough to have cancer, well, when that happens to you, you demand everything to save your life, except for, so we do everything, except for now we're finding that, guess what? Mammograms probably not such a grand idea. They're causing interventions for people that, you know, shouldn't have had anything done. And just this week, we find out, guess what? PSA test, prostate-specific antigen, same thing. By the time men are 80 years old, 90% of them have prostate cancer. It's not going to kill them. It lies there silently doing its thing. But because everybody demands everything and a little bit of defensive medicine, all these tests are being done that lead to extra care, which when you bring up, okay, what's Obamacare going to do? Okay, everybody deserves everything, right? You should have your mammograms, and dang it, you know what? Your aunt had breast cancer, so you're going to have mammograms every year, darn it. Well, never mind that the radiation actually brings on the cancer, but who's going to pay for all these tests, and then the false positives and the mastectomies or the lumpectomies, and then the lymphedema that develops as a result of all the interventions that perhaps your breast was perfectly fine in the first place.